So, continuation of the previous video, the gerontologic roles we will see one by one. First one is healer. See, you can study these headings and you can write your points by your own. Okay, there is no problem in that. So, healer. So, nurses plays a significant role in helping individuals stay well, overcome or cope with disease, restore the function, find meaning and purpose in life, and mobilize internal and external resources. So, a holistic approach is essential to recognize the older individual. So, holistic approach means it doesn't concentrate only in the disease or to prevent the disability. Older person as a whole, we have to take care. So we know that the elder people need concern. So if we are not minding them properly, they will feel very sad. So as nurses, we have to act as healer. Even a single touch is having a healing power. So advocate, as I told before. So advocacy including aiding older adults in asserting their rights and obtaining required services, facilitating a community or other group's effort to affect change and achieve benefits for older adults. So the services or the rights which is having benefits, that should be found out and should made accessible to this older person. So next is caregiver. So of course we always function as caregivers. So the major role filled by nurses is that of caregiver. So in this role, the gerontological nurses use gerontological theory. So in the conscientious application of the nursing process to the care of elders. So here, so the gerontological theory which saying about this, which all about a conscientious application of nursing process. So conscientious means what? With interest, with complete interest as well as sincere in the work. So that is all about gerontological theory is focusing on. So the gerontological nurses use gerontological theory in the conscientious application of the nursing process to the care of elders. So it focuses on promotion of the highest degree of self-care of the elderly. That is about caregiver. And next, the educator. The gerontological nurses must be prepared to take advantage of formal as well as informal opportunities. See, we can talk in a formal way as well as in an informal way. I think while you guys go to the ward, how you will talk to an older person? Very informally, right? So I can take examples. While I was teaching Matthios, your seniors. So I have seen how they used to talk with the patients, elder patients. Achacha, apapa, apupa, all those things. So very informal way they used to talk as well as they used to teach those persons. So that will be beneficial comparing to the formal. That's a suggestion, my personal view. Okay, so gerontological nurses must be prepared to take advantage of formal as well as informal opportunities to share the knowledge as well as the skills related to the care of older adults. So this education extends beyond professionals to the general public. So essential to this role is effective communication involving listening, interacting, clarifying, coaching, validating as well as evaluating. So that is about educator. So again, I'm repeating, you can study just this heading and inside this you can write by your own. So innovator. As an innovator, the gerontological nurse assumes an inquisitive style, making conscious decisions and efforts to experiment for an end result of improved gerontological practice. So that is about innovator. We should be in a way that we should be having very much interest, or we should be very much curious. So that is all about inquisitive style. So making conscious decisions and effort to experiment for an end result of improved practice, gerontological practice. So, and finally, advanced nursing practice. So, to competently and effectively care for the clinical complexities of older adults, the nurses need preparation in the unique principles and best practices of geriatric care. Advanced practice role include the geriatric nurse practitioners, the geriatric nurse clinical specialist, and gero-psychiatric nurse clinicians. So geriatric nurse practitioners have been shown to improve the quality and reduce the cost of care for elderly persons in hospitals, nursing homes, and ambulatory care settings. So read this again. Geriatric nurse practitioners have been shown to improve the quality and reduce the cost of care for elderly persons in hospitals, nursing homes, and ambulatory care settings. That means we are working in such a way that we are reducing the cost, but we are not getting adequate salary. That's the problem. So here, I would like to say one thing. So in abroad and all, there are specialized section, means areas, geriatric care. So many nurses are going for geriatric care. The problem is that there it is very difficult, geriatric, and sometimes in not in UK, Saudi, Kuwait, Qatar, and all. So while a nurse is going for the first time, she will be admitted in a geriatric clinic or geriatric care center. Then only she will be shifted to, after training, then only she will be shifted to other areas. So previously it was like that. So nowadays we can select the areas and go. So we'll continue in next class. So thank you so much.